From 2010, Ridge Meadows Division of Family Practice has been thriving to create meaningful, positive impact in physician satisfaction. We envisioned a community that improved patient care through physician leadership and voice. We're proud to say that after 6 years, we've succeeded in bringing our vision to life with your help. And our last year was one of the best yet. We're excited to have a team of hardworking physician members that are eager and willing to make significant healthcare improvement. Together, we have fostered a warm and welcoming community of members that feel close to each other and united by the goals we set to achieve. Hitting the milestone of 100 members, we managed to implement 30 projects that really made a difference, covering areas such as a GP for me, GP Extender, Nurse in Practice, Nurse Practitioner, Physician Recruitment and Retention, including Health and Wellness, Find a Doctor websites, Red Carpet Partnerships, Mentorship Program and Clubs, Addictions Inquiry, MOA Network, Member Education, Technology, Pathways, EMR Support, other technology tools, Child and Youth Mental Health and Substance Use, TIES Technology Pilot, Ridge Meadows Youth Wellness Center, Service Inventory, Education, Networking, and Peer Support, Residential Care, Hospital Acute Care and GP Communication, Maternity Clinic, Seniors, Service Inventory, Home Health, and Cares Pilot, Complex Care and Community Attachment, Billing Advisor Program and Doc-to-Doc Referral Tool. Our initiatives were created and implemented to support the entire ecosystem of medical community, starting with the physicians themselves, following through patient care, and also attending to the needs of Ridge Meadows. The efforts of the division members and the stakeholders' involvement were crucial in the success of our accomplishments. The areas the division focuses on are healthy primary care physician community, patient supported in the community, community access to primary care, improved system capacity, member engagement and communication. Because we know that a healthy system starts with healthy primary care physicians, we focused a part of our efforts and assets on supporting and sustaining their education needs, health and wellness, and recruitment and retention. In implementing the initiatives for this purpose, we engaged 91 members and community stakeholders. We recruited 17 physicians, attached 14,000 patients, held 40 education sessions and 15 club meetings. The GP for Me initiative, blended with practice nurse and GP extender projects, tested what team-based care could look like in physicians' offices, resulting in reduced lower-level clinic tasks and administrative work. The results speak for themselves. The GP extender could save a GP on average 48 minutes per day and a practice nurse 44 minutes to 1 hour and 35 minutes each day, depending on delegated tasks. Now, this is spectacular news that could ease and improve the work proficiency of physicians. Our already very well-established MOA network was a star this year with a rising demand and a focus on education. Another accomplishment we're proud to announce is our firm's advancement in the physician health and wellness area that aim to strengthen social connections, retention, and collegiality. To build social connections outside of the workplace, the division hosted 6 clubs throughout the years: Old Docs, Young Docs, Everyone Welcome, Women's GP Clubs, GP Husband Partner Clubs, and Welcome Wives Partner Club, gathering 96 attendees with 15 meetings. Our mentorship program, matching seasoned community doctors to new doctors, remains strong with 9 matches. And since members showed their vivid interest for more events and social gatherings, the division also hosted a barbecue, wine and food pairing social, member learning event, and walk cycle in memoriam fundraiser this past year with a total of 369 attendees. When it comes to physician recruitment, 2015-2016 has been a very good year with 17 physicians recruited to our community. The division will continue to be active in recruitment with GP Tours, the Red Carpet Program, working with community stakeholder, outreach, welcome guides, and marketing materials as we meet upcoming retiring physician needs. In 2016, we hosted our first community conversation where 100 community leaders joined the division to support physician recruitment. And because nothing is complete without a solid base of knowledge, the division and medical community held 40 education sessions with 341 physicians, MOAs, participants on topics such as musculoskeletal, how to get the most out of pathways, glucose-lowering medications, EMR basics profile and Osler, home health, and polypharmacy reduction. Patient Supported in the Community direction focuses directly on supported initiatives regarding maternity clinic, seniors, residential care, child and youth mental health and substance use, and addictions inquiry. We strive to make a difference with the help of our 130 members and community stakeholders by offering patients the support they need for better healthcare and prioritizing vulnerable populations. In 2015-2016, we managed to create a senior patient inventory, provide residential patient care 24/7 coverage, recruited a child-youth psychiatrist, and started our Ridge Meadows Child and Youth Wellness Center pilot and Addictions Inquiry Initiative. To help senior patients, physicians, and people supporting seniors, we have created a Seniors Guide of Services in our community and hosted a Seniors Health Forum to create senior service awareness. We continue to work on supporting and improving the home health relationship with Fraser Health. When it comes to the maternity clinic, the division has been focused on physician recruitment. We improved patient residential care by creating a call group of 11 physicians who participate in the provision of 24/7 coverage, 365 days a year, in 4 long-term care facilities. The lack of access to services and awareness of child and youth mental health and addiction patient services has been a big challenge. In this respect, we created a long-term vision with the community of opening the Ridge Meadows Youth Wellness Center, a one-stop shop where the community would get connected to an advocate to help navigate the system, providing access to clinical counseling, with specialty in addiction, along with peer support groups, education, a GP on-call group, and psychiatry. $35,000 was fundraised through community donations that enabled us to start a Begin and Monitor pilot with the hiring of an advocate to help patients connect to services. Moreover, the center now offers child and youth psychiatry one Saturday per month with Dr. Matt Chow. In the following year, the division wants to deeper tackle the addictions and chronic pain area. With recently approved funding, we intend to put forth a proposal solution to shared care. The community access to primary care work also managed to make a difference thanks to its 23 members and community stakeholders. With 4 billing advisors, we succeeded in delivering billing support clinic visits complimentary to members and providing a variety of education sessions. We also reached 15,500 plus views on the Find a Doctor webpage thanks to our 20 listed GPs throughout this past year, and currently have 12 GPs listed on the private doc-to-doc referral listing to help with attaching complex care patients. In the previous year, the division worked in 2 areas: the nurse practitioner in the Salvation Army Homeless Shelter and the Complex Care Attachment Program. By bringing and supporting a nurse practitioner to Ridge Meadows with mental health, Fraser Health, and community stakeholders, the division was able to provide primary care to the homeless, mentally ill, and addicted population that was underserved and overutilizing the emergency department in the hospital. Another accomplishment we're proud to announce is the impact funding the division received to continue the Complex Care Attachment Program that focuses on billing advisory services, private doc-to-doc referrals, and general public Find a Doctor websites. We also wanted to meet the needs of patients who are discharged from hospitals without a family physician. Thus, we enrolled 12 physicians on the doc-to-doc referral list who are now waiting for calls related to patients with complex care needs. What's more, the division also created 2 websites, www.findadoctorpittmeadows.ca and www.findadoctormapleridge.ca, available to the general public seeking a family physician and docs who are accepting patients. This has also been a strong tool for physicians moving to Ridge Meadows and wish to build their patient panel before they arrive at their clinic. 38 GP MOAs attended a billing support small group learning session, 8 clinics received billing advisory support, 498 complex care patients received care billed through incentive fees, and 4 MOAs have been coached as the division's billing advisors and are available to clinics for their own one-on-one support. The improved system capacity worked with 29 members and community stakeholders, developed 18 technology initiative education sessions with 121 attendees, and ongoing strong support on pathways and our EMR peer mentors. Our initiatives: hospital acute care and GP communications and technology left 94% of GPs and hospital-based physicians feeling an improved communication between hospital and family physicians and members well supported in their technology needs. The division's main hospital acute care and GP communication project intent was to improve hospital patient discharge communication to community physicians along with education. The results? More than satisfying. 55 physicians, specialists, pharmacists, and Fraser Health representatives attended the ER education session and medication education session. 75% of ER physicians felt there was a decrease in inappropriate referrals to the ER. Over 90% of community GPs and hospital GPs felt communication improved. 50% increase in GPs' notification about patient death within 24 hours, 78% compared to 52% at the start of the project. The division also held trainings and sent communications related to physician technology, including EMR pathways, up-to-date, and various other tools for more efficiency and a streamlined activity with 7 EMR peer mentor site visits and 7 pathways clinics trainings. We saw a 31% increase in pathways usage due to the on-site clinic training. When it comes to member engagement and communication, our division is doing better than ever with 245 members and community stakeholders involved. Networking, socializing, sharing, learning, and overall connecting with one another is held in high regard by the members. This is clearly visible in the various successful events and gatherings such as the Family Summer Barbecue, the Walk and Cycle Community Spirit event, the New Year Member Engagement event, the annual general meeting social, and many more. We value our members, and the 69% member engagement rate tells us they also value us, building together a formula that adds to the division's successes. Our efforts would not have paid off without our members' continuous support and involvement. In only 5 years, we have grown our membership pool by 60%, reaching 100 members this year. Now we have even more strength to make an impact in physician satisfaction and improve patient care. The 100 members milestone assures us we have a new generation of physicians to take over and fill the space left by retiring ones. Our efforts, however, do not stop here. We're stronger than ever, and we have even more drive to make a change for the better. As we look at the year that passed, we can only cherish for a few moments our accomplishments as we're set to move forward with new projects, new initiatives, new results, and new members. We thank you for contributing and building new and high standards for the benefits of both physicians and patients and a better community. By being a member and investing over 1,500 of physician hours into the work of the division this past year, you have played a significant part in delivering projects that truly impact the healthcare scenario of your community. Let's set out for an even better year. Together, we are making a difference.